Some of Australia's top psychologists have raised the alarm about young Australians' mental health, with doctors warning our system has led to ineffective care.
Joining us to discuss is President for the Australian Psychological Society, Dr. Katrina Davis-McCabe from Perth. Doctor, thank you so much for your time. Talk us through the scale and the urgency of this problem right now.
Yeah, good morning, and thanks very much for inviting me. The scale and this problem is absolutely huge, and perhaps one of the biggest that we've ever faced. We are in the midst of a mental health crisis. People are suffering. We've been through a pandemic, natural disasters, and climate change. And what psychologists are seeing is an increase in people presenting for treatment. This is presenting with complex mental health disorders and other psychological problems and issues, but across the board, an increase in presentations. And this comes at a time when the government have actually halved the amount of Medicare rebated sessions to people. So when people need it the most, they're not able to access an adequate amount of sessions that they need for their treatment.
Katrina, can we ask you then about young Aussies out there who have also had to go through this? What are the main reasons they're struggling to access this appropriate care? Is this government issue again?
Yeah, look, there are many different issues for young people, and young people are struggling just as much as adults are. We know that by the time someone becomes an adult, often a mental health diagnosis has started around the age of 14. So what we need to do is to get in early to try and help that young person so that the mental health doesn't develop later. We also know that young people are more likely to attend treatment if they're able to access it easily. And we're really pushing for psychological treatment to be available in schools so that young people can access it without needing mum and dad to pay, so that it's going to be there day to day when they need the treatment.
You sort of touched on this earlier, but 6 months ago, patients were eligible to receive 20 subsidised psychology sessions. That's now been scaled back to 10. What was your reaction to that change, and how concerning is that to you?
It's so concerning. We're really disappointed by it. And we have actually, we've raised this with government numerous times. The problem is that 10 sessions for some people is not an adequate dose of treatment. So when they are experiencing complex mental health disorders, and I'm talking about things like persistent depression and some anxiety disorders, the research shows that they actually need between 18 and 20 sessions to adequately treat that. So when we remove those 20 sessions and give someone 10 sessions, it's not enough to treat the disorder. So we see a revolving door. People keep coming back and are undertreated, or keep coming back later for more treatment, and then they're not getting the issues adequately resolved.
So this is being compared to having half a course of antibiotics. I mean, what are the long-term effects of patients being undertreated?
You're exactly right about that. We would never do that. We would never give someone half a dose of antibiotics. So why would we give them half a dose of psychological therapy? What we'll see is that people either won't access treatment, or people are rationing their sessions. So they're trying to spread them out throughout the year, or they're only attending half a dose of treatment. So they're not getting better. They're going to come back next year. And actually what we're going to see is people are going to be feeling worse year after year.
Yeah, and like a lot of other treatments like that, when you start to do mental health treatment, you're just starting the journey of unplugging a lot of things.
You've got to be able to follow through.
You've got to follow through.
All right. Absolutely. Why would it be treated differently to health issues? You know, there is no health without mental health.
Exactly, and good on you for putting a spotlight on it. We appreciate you joining us this morning. Thanks for your time. And if you or anyone you know is struggling, please call Lifeline 13 11 14.
Hey there, Today fans. Sarah and...
What's my name again?
Oh my God. Carl.
Hey, thanks for watching our YouTube channel, though. Subscribe now for more news, special reports, and amazing Aussie stories.
And Carl misbehaving,
Whoa,
of course.
That never happens.
Always happens.
What's she talking about?